We thank you all so much for joining us this morning. My name is Greg Kelly, president of SEIU Healthcare Illinois, and we are here this morning because we're reaching a really critical point in terms of the ability of healthcare workers and systems to be able to provide the emergency care and critical care that so many folks need in this moment. One way to measure that is the ability of hospitals to provide a sufficient level of quality care to patients facing healthcare crises. Under typical circumstances, the state allows hospitals to go on ambulance bypass when they don't have the resources or capacity needed to provide the level of quality care. But in recent days, hospitals have been ordered by the Illinois Department of Public Health to not go on ambulance bypass. Simply said, this means that there's a need for emergency and critical care, and it's just too great at this time for the regular standards to apply. And it's not just our healthcare systems and infrastructure that's reached a breaking point. Of course, when COVID started, we'd hear every day or pretty regularly about the impact of COVID on our healthcare heroes. And unfortunately, these never-ending crises sparked by this pandemic has made the situation worse. Hospital workers have been bearing the physical and emotional and economic burden of providing frontline care these many months. And without a break, I must make that point. While some of us saw the decrease in cases as an opportunity to go back to some sense of normalcy, healthcare workers like our members have continued to work in the midst of this crisis, and many of them continue to get sick. Everyone, everywhere is short-staffed. Workers are routinely working double shifts and more than one job. And every day they are expected not just to deal with COVID, especially this newest insidious variant, Omicron. They're also hoping not to learn any of the other Greek alphabets, but they also exposed to physically demanding labor, more work than they can do, more patients, more needs, more stress, and more emotional turmoil. This is hazardous work and has been. And at the very least, these workers deserve hazard pay, universal, no questions asked hazard pay for doing such demanding work under such hazardous conditions. As you all will hear in just a moment from workers, not everyone is getting hazard pay, and not everyone is getting the other sources and resources and support that they need to make their burden just a little less burdensome. And as the growing COVID numbers will show you and tell us, their burden is getting bigger every day. Now, we share, and when you share a large burden on a community, it's important that everyone do what they can, especially when they are living on the line. That's why workers are calling for some relief in the form of hazard pay and other forms of support. And that's why they are calling for large health systems to do their part to help in this ongoing crisis. When poor hospitals need to transfer patients, they all too often find that richer health systems like Northwestern Medicine won't take them. And to mention Northwestern again, it seems appropriate to mention that the health system has billions in assets, that's billions with a B, and continue to do elective procedures, even as the governor requested a moratorium on such procedures. My understanding is that Northwestern has recently cut back on elective surgeries, which is, of course, a move in the right direction in our view, since every staff hour or every hospital room that's used for a elective surgery really helps or hurts the ability of workers to provide healthcare to those who need emergent care. And during this public health crisis, we've got to get our priorities right. And that's why we're here today. We're sounding the alarm to whomever will listen that healthcare workers are continuing to fight and continuing to deal with really tough conditions and tough environments. And we're just asking that hospitals and the entire healthcare delivery system provide the type of support that workers need in this moment. They really are healthcare heroes, and they form the backbone of our healthcare delivery system. Let's do right by them. We need them, and we need them healthy and safe and emotionally supported. And so with that, we'd like to invite a number of healthcare workers and an elected official who's going to offer some remarks. Our first speaker is Wellington Thomas, who works at Loretto Hospital on the west side of Chicago. Wellington.
Thank you, Greg. Good afternoon. Actually, good morning. I apologize. My name is Wellington Thomas. I'm the lead emergency room technician at the Loretto Hospital. One of the things I can say personally that COVID has came back with a vengeance. It's saying that, when we had the first wave almost 2 years ago, it was bad. This time is probably the worst I've seen it. Even in my department, we've had at one point almost every patient in our rooms was all COVID. We've had patients in the hallways, several beds in the hallways, several recliners in the hallways with patients being there because we just don't have the room. One of the things that was brought up is that ambulances right now cannot go on diversion. At times we get challenges from EMS because we have to hold them from 10, 20 minutes to almost 2 hours because of the pandemic because of everything that's happening with the COVID, because of the influx of patients that are now visiting our emergency rooms. As far as workers, I will tell you this. At one point, I almost decided to change careers. I've been doing this type of work for over 20 years, and it's been that stressful. From some of my colleagues, very stressful, leaving here, coming right back to help just because of the overwhelming of patients that are coming in, and also because of short staffing, because right now, during this pandemic, there's a lot of factors that is in play. You got staff, there's hospitals that's facing short staffing, particularly my hospital, and I'm sure that many safety net hospitals that's facing the same thing. But at the same time, we have workers that's always talking about, well, we're doing all this stress, we're taking all this, and not only the stress that you have at work, remember, we're taking these type of stresses at home. And us doing that, one of the things we would like for management to do is to begin the talks of hazard pay. One thing is, before at one point, some hospitals have taken on a challenge to provide hazard pay for our facilities. Right now, this is even worse. And I think it's the first time that I can remember of us going on diversion this long and not coming off. I've worked on both sides of the fence. I worked on EMS and I work in a hospital emergency room. So I do definitely see on both sides how this affecting both sides of the fence. Whether we talk about hospitals paying out hazard pay or retention pay, because right now the challenge is to keep staff. Right now a lot of hospitals are losing staff members because A, the stress they're going through, or B, unfortunately, some take on other duties at other states, and we're asking hospitals to do what is necessary to take care of your workers, appreciate your workers for everything they're doing during this pandemic. And I'm there as a frontline worker. We have to do whatever is necessary to keep our workers safe, which means including making sure that we have all the necessary equipment, all the necessary masks at all times, the right size, of course, and making sure we have all gowns and gloves without no problems. One of the other challenges that we face is isolating patients. And what I mean by that is sometimes we are overwhelmed that we find out that patients that are being admitted has been exposed to the staff because, of course, the rooms are not available because all the rooms in the emergency room is isolated because of COVID patients, and now they're positive. So now we're being exposed to these different type of patients, and it's very difficult for us to isolate them. We do face difficulty of transferring patients, especially trauma patients, especially patients that need care that we cannot provide. And sometimes, as far as trauma, it could take us hours. And some facilities, when we had to transfer a patient to another facility that have a specialty that we don't provide, we face challenges as far as they can't take the patient. We have to try to look for a hospital, and at times we can't even provide them. We can't even transfer them because hospitals won't take it. I want to let everybody know that we're doing absolutely everything we can as healthcare workers, as emergency workers, as hospital workers, but we need to make sure that whoever's hearing us, that we need to be taken care of. The legislators need to do everything necessary they can to help provide funding for all of our facilities. And with that being said, I'm going to turn this back over to Greg.
Thank you so much, Wellington. Thank you for your work, particularly in this moment. I'd like to invite Kim Smith, who works at Northwestern Medicine, to offer some words. Kim.
Good morning. Thank you again, Wellington. So my name is Kimberly Smith. I'm a patient care tech at Northwestern Medicine, also a steward, just like Wellington. And when you talk about the work that you do as far as providing care for your patients, the problem is we can't do that efficiently. So I'm here speaking out today because we are nearly 2 years into this pandemic and there's no end in sight. There's no relief in sight for those of us that are on the front lines. When Wellington talks about us being overwhelmed and stressed, and it's a mental health, burden as well, that's a serious issue. Because I work at a hospital with a lot of financial assets and with a reputation for providing quality care. And unfortunately, it's making it difficult to do that. So you would think that an institution like Northwestern, that they would have enough resources so that it can help the frontline workers, so that we can do our jobs and with some degree of security as well as peace of mind, just thinking about our overall safety. But the truth is that we are short-staffed, just like hospitals everywhere else. We don't receive hazard pay at all. And especially, it's just not even done in an equitable way where nurses are receiving a stipend, but the support staff are not. And so we don't even have the full resources to protect ourselves, especially with this newest variant. And it has cases spiking all over the place. We're working with coworkers who are coming back positive, and it's making it even more easily transmitted amongst us. So we are speaking today, and we're speaking out because we're asking for some type of consistent and fair hazard pay. I don't care if they want to call it a temporary bonus, a premium, whatever it is, but it's for all hospital workers. Because every time you cross that threshold, you are then set up for exposure. And that's the sad part. So everybody should be protected. And like Wellington said, there should be some type of incentive for retention for the workers. Because like he said, he's been in it for over 20 years. This year makes 19 for me. And you know what? I'm thinking the same thing, that maybe I should change what I do. But I like what I do. I like delivering the patient care. So it's like you're caught between the two. Do I think about my safety first? Or do I continue trying to protect others? So we are asking for the different staffing levels to be addressed, because this is what helps us with our patients. When we were talking about the elective procedures, we're talking about those things. And the reason the governor is saying that is because it's one thing when you're getting something done and it's not something emergent, as opposed to someone who's coming in through the ER and is in dire need of a bed. If it's something that can be put on hold for a while, we need to take those things into consideration, because we are in a situation right now where we're short-staffed. We have a shortage of beds, but we have a mass amount of people that need our help. And with this variant spreading, we all need N95. It should be a protocol off that, not just the distancing. And not to mention the fact that some of the areas that we work in cannot provide social distancing. When you think about a pharmacy area or a labor and delivery room or an ER, just different various cases like that. So, we're having this conversation because most of all, we need to respect our voices. And the only way that these different organizations will do that is by actually listening to the worker. When we are addressing these issues, it's not us just talking, it's because we are in the moment, we're living in the moment, and we know exactly what we need to protect ourselves and to protect our patients. Because again, remember, we're coming to work every day because we do care about patient care. I've been working in the healthcare field now for over 18 years. And I can tell you that in the most recent months, this has been the most physically, emotionally demanding time in my entire career. And as a frontline worker, we cannot go on like this because people will walk away and they won't come back. We need some type of relief. We need some type of respect. We need some type of support, and we need it now. It's the time for universal and fair hazard pay. It's a time that Northwestern and other hospitals need to get their priorities straight, and it's time for them to listen to their workers.
That's
So
right.
I won't go on, and I appreciate you for letting me speak, Greg. Thank you.
No, thank you, Kim. Really appreciate your passion, of course, and really appreciate all that you do to care for the folks who need help in this moment. So to summarize, we are saying to all healthcare employers in this moment, your workers are hurting. They need help. They need support. And in hospitals in particular, the wealthier institutions like Northwestern need to do a better job of offering the type of incentives to their workers that they need in this moment. There's more that you can do, and we expect more. And so we're calling on you to do more. Institutions like safety nets, like Loretto, need support in this moment. The workers who are on the front lines of those institutions need help. Nursing home workers, home care workers, all healthcare workers in this moment need help and support. Our healthcare system is on the brink, and Omicron is here today. What will be here tomorrow? And so we need to prepare for any potentials beyond Omicron, but we are in a crisis at this moment, and we are demanding that hospitals do their fair share to protect those workers who need all the support they can get in this moment. And with that, I will step back and see if there are any questions that folks may have to ask of either Kim Smith from Northwestern or Wellington Thomas from Loretto. I can answer some questions as well, if necessary.
I think there's a question for you from Joe Marr of the Trib, and another one. Just if pay attention to the chat, we have two questions now. So
okay, let me see the questions. Do you want to come off mute and ask them, or
Joe, do you want to ask your question?
Oh, that's okay. Yeah, I'll come off mute.
okay.
I'm a real person, so I'll let you.
that's good.
Face there, not nameless and faceless out in the ethos there. Here's what I want to understand, because there's a couple arguments going on here. Number one, I get hazard. I get the argument for hazard. That's pretty simple for me to understand. What is harder for me to put in context to make sure I understand is that there is an argument that safety nets are slammed, right? And there are these bigger hospitals that seemingly have more room and should be taking transfers. At the same time, I'm hearing Ms. Smith say, hey, I'm at Northwestern and we're slammed too. We're short-staffed. We need help. So I'm hoping you can put that in context for me about kind of how you view this issue as far as should they take them, kind of what's the solution as best as you can tell right now?
I think one of the solutions, and I think we give the governor credit for saying or suggesting that hospitals defer non-emergent or elective procedures. It's our estimation that would, in fact, allow for more beds to be available. You could shift staff. So that's one certain way that you could do it. And we've been asking them to do it. I think Northwestern made some minor shift, but we think that that's an important tool that institutions like Northwestern and others could use to alleviate some of the pressure. Some of it you can't, right? But certainly any little bit helps. And we think that's one of the ways smartly that the governor proposed doing that.
And I've got some follow-ups, but I don't want to monopolize. So what I'll do is I'll take myself off. I'll let other people ask questions and I'll probably come back just to be fair, if that's okay.
No problem, no problem.
And there's a question from Marnie Pike. Marnie, do you want to ask your question?
Hi, easy question. I just wondered, could you get us a list or an idea of, the hospitals, the hospitals you're representing on behalf of the workers?
Catherine, yeah, we can get that to
Yeah,
you.
actually, yeah, I can handle that one. Let me go ahead and work on that for you, Marnie.
Thanks. And since I've got the, maybe the healthcare workers could talk to this. So like the state had like its biggest surge of cases, like in the 42,000, 44,000. It was last Thursday and Friday. And then there's like this lag time that it takes for, people to be sick enough to be hospitalized. Are you anticipating that it's going to get even worse, like next week when that huge bump of cases ends up in hospitals?
Wellington, you'd probably be a good person to ask that since you're in the car.
I would say definitely. I mean, from when this pandemic started until now, even like my last 2 weeks, we've seen patients being coded in the ER back to back to back, even like a shift. I had like 3 or 4 codes on one shift, which is very drastic. And it's like every week, and even night shift, they're coding patients. And all these patients are coming back COVID positive. He just gave you a quick story. We had a patient that went to the restaurant. They had some trouble breathing. They come to us, and unfortunately, we could not save them. And they was COVID positive. It's a lot of patients that's definitely coming in here from this moment. If we look at the timeline from March up to 2 years ago until now, it's worse. I mean, and the only thing I could think of is, man, we're going to get even worse. I mean, from the timelines, oh, man, I could say probably double or triple.
Kim, do you have anything to add to this part?
Not really. I mean, it just, what he's saying is actually correct. I mean, when Wellington is speaking about the numbers doubling, that's pretty much what's happening, because on top of that, then the workers get sick. Like, I was on labor and delivery. The mom came in to deliver. She came in. She was supposed to be COVID negative. During the labor, she ended up starting coughing. She got a fever. So then mom got re-swabbed. By the time she delivered, which the second stage of delivery is aerosol spray, she then was COVID positive, which then the neonate was COVID positive. And then everyone in that room is therefore then exposed. So the numbers continuously heighten, because then now this mom is now positive, which then adds to the numbers. Then the caregivers who are in the room who weren't wearing N95s because she was allegedly negative now have then been exposed. So that's why it not only affects the people that work there, but now we're talking about communities, because then now it goes out to the families, the people that we all live with, and it then makes the numbers even worse. So that's why, another reason why it's not, as we want to say, grasping a hold to slow those numbers down, because the people are coming in sick. With CDC saying people can come to work after 5 days and they're supposed to be asymptomatic, then it's relying on people to be, to be honest. But when people are struggling financially, then they're coming back to work, so it makes for a different type of crisis.
Yep. The one thing I really want to stress here, and please, Kim and Wellington, take just a few seconds to really talk about, and you all are leaders and workers in your work sites, right, at your hospitals. I think it's important that the public understand sort of the mental and emotional toll that you and your coworkers are sort of experiencing on a regular basis these days. And I just wonder if you could just take a second or two, both of you, to kind of talk about that just a little bit.
I'll say this real quick, Greg. I mean, like I said earlier, I was ready to quit. I've been doing this for almost 20 years. Some of my coworkers that rarely come in, they was coming in to help. And it's like me going home to my loved ones. It's like, it's hard to even spend time with your family because you burn out. It's hard to spend time with my kid because I'm burnt out. And then even us coworkers or healthcare workers try to rally each other up. And even you only could go so far of doing it, And it's just so many patients that flow through here, and it's just hammering and hammering and hammering. I'm telling you, and my mental state has definitely changed. Like I said, I'm always doing what I can. Like Kim said, you try to decide what's best. Should you come in here and take care of your patients, Or do you look at your personal health? And it's, man, and mental health is serious. I mean, I can tell you that it's very, very serious. My mental health has been all over the place. And, you know, even I had a sibling that went through the same things. Mental health shut him down for months. And that was the first, when it first came out. Now that COVID was here with a vengeance, it's just, wow, what could happen? That's the biggest question right now I see.
Yeah. Thank you. Thank you, Kim. Could you just for a second too?
So the reason that I spoke on the mental health aspect is because I actually like what I do. I love what I do, but I am now afraid to go to work. I've been the person that was at first afraid to get vaccinated because I wasn't certain about it. But then I said, okay, this is what we do. This is how it works. I get vaccinated, I get boosted. But then now I'm going into a workplace that is supposed to be a safe haven, and it's not. It's not safe inside my workplace. You know, there was a comment that was made when COVID first came out about being more safe at work than going to a grocery store. That's not the truth anymore. The truth is that I'm going to work and I don't know if my coworker beside me has COVID. And then I have to worry about taking it home to my 4-year-old grandson who's too young to get vaccinated, or me being too old to get sick. And I'm worried, and then, the fact is that I want to care for someone appropriately because they have been sick and they deserve to have the best care ever. They're already afraid. But how do I deal with my own personal fear and say, let me get over this hurdle so that I can help them if I don't even have a break in between? But I can't catch a breath. It's like you're swimming, but now I'm drowning and I can't catch a breath because every time I think that I'm going to get a gasp of air, here comes more. And then I'm getting more. And it becomes that point where now it's like pretty much we have to have some type of faith base. Because if we don't have a faith base when we go into this job, we're going to lose it mentally. Because I go to my break room and then do I eat my lunch or do I wait until no one's in the room so that I'm trying to make sure that I don't get COVID? Do I go into a patient's room with an N95 and then they're worried as to why I'm wearing that type of mask instead of a surgical mask? Do they have COVID? But it's about the safety. And then it's like, when you think about the mental health and, people say, well, maybe it's just schizophrenia. It's more than that. It's just your day-to-day living.
Okay. Thank you. Thank you both for that. I think, Joe, you had some follow-up. Joe, can you come off mute?
Sure, yep.
Yeah.
All right, so maybe tougher questions to kind of understand about it, but I've been trying to get my arms around this whole issue too. And I'm wondering in general if the union has any calls for the state to go back to the old ways of bypass. So IDPH has basically said, hey, everything's crazy out there. We're not going to allow bypass except for extreme situations. And your argument is basically, hey, that means our safety nets are getting slammed, right? We can't divert, so we're getting slammed. So is it? I don't want to put you guys where you don't want to be, but I got to ask you. Are you guys saying, hey, IDPH, knock it off, let us bypass so we can divert people to places that have more room?
We don't have a position yet. In fact, that's one of the reasons why we wanted to do this presser today, really is to sort of sound the alarm. And we're continuing to have conversations with the various employers, and we continue to engage with the state on this stuff, and not just in hospitals. This is also related to nursing homes as well as home care and child care, for that matter. So it's a systemic problem that we're really trying to get our arms around. But for us, the first step really is to remind folks that there are people working every day, not just doctors and nurses, right? But emergency room techs like Wellington and patient care techs like Kim, who are continuing to work every day and need to be heard. And so we're going to continue to sound the alarm and continue to assess where things are in terms of policy and what IDPH is doing and what we might think they should be doing, Joe. So stay tuned.
Gotcha. Nothing yet. Probably the same thing. I'm assuming. Let me know. Right now is, there's no, as I can tell me if I'm wrong, but there's nobody out there in public health who is trying to arrange the puzzle pieces to say, okay, Loretto's slammed, Northwestern's at 20%. Let's move people over here. Northwestern, sorry, you got to take these guys. I don't see any of that anywhere. There's no mandates to accept transfers. So the system, as I understand it, and tell me if I'm wrong, is basically people calling around and hoping that they can get somebody to take somebody. And if that's the case, I'm wondering if the union has any position on trying to get public health involved more to kind of be the cops on the beat to police this. My assumption is probably the same as the bypass. That you're still looking into that and you have no position yet, but
that's
right. Want to make sure.
Okay. And I have, in fairness, it really, this thing has exploded in such a massive way, and then really in such a quick way, that I think folks are still trying to, including us, trying to get our arms around, like how does public policy impact this? A lot of it right now is employer to employer, hospital to hospital, nursing home to nursing home. But what really might be a robust approach to this, to an entire industry, is not something we figured out. And it wouldn't surprise me that other folks haven't either, because of the nature of it. But it is certainly something going forward that we're going to be laser focused on.
Gotcha. And then the other question I had, and this again may be in the tough category, it has to do with how bad things are. And as I understand the system, there are a few different designations. The worst one is something called crisis standards of care. This is a legal terminology that hospitals will use. And it was set up by the feds after Katrina and everything. And they basically said, if a hospital doesn't think it can provide adequate care, it can say, hey, I'm on crisis standards of care. In other words, they're rationing care. They got so many people that they just literally can't do a basic adequate job. No hospitals I know of has declared that. I don't think hospital execs like to say that kind of stuff. But I'm wondering in what your employees are describing, if they feel like it's either at crisis standards or close to it. And again, I don't want to put them in a spot they don't want to be in, but the view of hallways lined with beds and, things that may indicate that we're closer than, or maybe we're there. So again, I don't want to put words in anybody's mouth, but I am curious how they view that issue and how they view their ability and are they rationing care or not?
I'll go out on a limb and say that a lot of us may not know the technical terms, Joe, but I can assure you that when you talk to workers in nursing in hospitals and nursing homes, for that matter, they will tell you that they are being slammed in a way that they have never experienced, even going, as you heard Wellington say, even going back to March of 2020. And that the numbers of patients have just been so great that it's something that's unprecedented, which is hard to imagine given just how bad things were in 2020. And so I think from their perspective, it's a very difficult time. I don't know, I certainly wouldn't know what the technical name of it is, but certainly they need some relief and they need some support and they need to be compensated as well to reflect all of the struggle that they're going through in this moment.
And Wellington, if you don't mind me asking you, just had a quick question. Are you just on a break right now? I see you in your car and I wasn't sure if you were just on a break from the hospital or I saw you scrubbed in your car. So not to be nosy,
Yeah, absolutely. I'm actually stepped out to, do this presser because I think it's very important for everybody to know what's going on. But absolutely, I'm actually at work. I'm actually myself picking up more shifts because of their staffing issue. And because of what's going on in ER, that's a good point. And one other thing I will say is the backtrack is that, look at the EMS perspective. Because remember, when the hospitals are held up, then the paramedics can get back out, EMTs can't get back on the road. And that's the challenges we face as hospitals, even as a safety net or a big hospital. You can't even get them back. And then we get complaints from them too. And then, of course, when we do that, then 911 is held up. Now they're talking about using fire engines in certain places or using other people just to get to those patients that need help. But it's harder for us because we understand, they got to get back out because we want them to save lives versus sitting here for 2 hours to, get back up in service.
And if you don't mind me asking, are you on 12s right now, 12-hour shifts or 8s?
Yeah, either 12s. I've been doing either 12s or sometimes I've been doing 16s. It's been
Really?
rough. Yeah, I've been doing a few.
What's today? Is today a 12 or a 16?
Well, today's scheduled 12. We'll see how it goes. Sometimes we start off as a 12 and then it gets bad and it's like, okay, we got to stay over. We even had staff members stay 20 hours. I mean, it depends on what's going on. Right now I'm at a 12. And as right now, I think all of our rooms for the most part is full, and this is, it's unique for us because we get business, but for all of our rooms to be filled pretty much every day for the last 2 or 3 weeks, it's kind of new for us, even our trauma rooms. And then now we got these hallway beds and they're just coming in and out. And of course, we deal with a lot of substance abuse patients and psychiatric patients, and all those numbers go up too, even during this pandemic. So.
Well, thank you.
Thank you, Joe. Unless there are more questions, Catherine, I don't know if you see any. I'd like to thank everyone for joining us. Again, healthcare workers, hospital workers, nursing home workers, home care workers, as well as child care workers continue to fight and deal with COVID. And we need to make sure that they are, even now, respected, protected, and paid. So again, thank you, everyone.
And let me add our apologies, but Illinois State Rep Cam Buckner had intended to join us, but he had a emergency meeting that he hasn't been able to get out of yet. So unless he jumps in the next 30 seconds, I would just say if any media on the call have questions that would be appropriate for him, we can try sending them to him later in the day. But our apologies. He had confirmed and then something came up, as it is likely to do in these days.
Thank you, Catherine. All right. Thank you, everyone. Thank you, Kim, and thank you, Wellington.